morning, good afternoon, and good evening, quoting Professor Chi, Heart and Soul of the Win Foundation. I'm extremely happy today of having with us also Professor Sriram Narayan from Singapore, and also Uwe Meyer, leading figure from MEDI World. We are reproducing the 15 minutes that we were used to share in a coffee break during the meetings that were very probably among the most precious moments of sharing, of social times, but also of new projects development and of important met and unmet needs sharing. Again, it's my true pleasure having in this true care moment, that is the acronym of Together Reporting, Unbiased Education, Certification and Regulatory Education, giants like the ones we have today. So I will start with Uwe from Germany, asking the industry perspective. In this case, MEDI is of course an example in terms of quality and science. How do you perceive the current situation of COVID-related misinformation and in general misinformation, and also the fact that there is so much misunderstanding in certified versus not certified products? And I was mentioning COVID because, of course, compression can help in the self-management in a time in which it's not so easy maybe to go to a healthcare center, but of course it has to be the proper compression. So how do you perceive this issue from the industry perspective?
Yeah, Sergio, thank you for this invitation. I only can say we all need more education in compression. The more education, the less misunderstandings. And we strongly recommend certified products, and we appreciate all initiatives, for example, from Win-Win Foundation, True Care, but also other initiatives like, for example, ICC, International Compression Club, who brings a lot of positive education in compression, but also initiatives like, for example, ECOP, European College of Phlebology. They are working on a kind of degree, Master of Phlebology, with a clear curriculum. The more knowledge about compression is in the world, the better it is the therapy success for all of us.
Is there something you think we are missing as scientific organizations in this protection toward the patients and also of the industries who are investing time and effort in proper certification? Is there something you suggest us to do?
Yeah,
to increase,
there are a lot of compression products in the market, but there is a difference between certified products and non-certified products. I give you an example. We at MEDI, we try hard to produce our products according to special standards, quality standards, but also product standards like Viral standard, which is well accepted in Italy, in Germany, and other European markets. And the more you take care about this, the better is the therapy success for the healthcare professionals.
And I know Willy indeed has been working a lot on certifying also the pressure values. Willy developed very interesting devices to measure exactly the dose of compression that we are used to say is like the dose of a drug. So Willy, would you like to jump on this?
Good morning, good afternoon, good evening. Just like Sergio said, Uwe, it was good to see you again online. My question to you is somewhat related to what Sergio has said. What does certification really mean for MEDI as a global authority in compression stockings?
This is for us the key, as we produce all our stockings according to this Viral standard. This means you have a graduated compression of compression garments, and this means also that you have a right dosage of compression. And this is tested not by MEDI itself, by independent testing institute. And this is not voluntarily, this is compulsory. So MEDI is forced to send from every stocking a pair per year to an independent testing institute, and they are testing the compression profile, the durability, etc., etc.
And where is a patient able to see this? Is it like, of course, clearly put on the box? Well, if we have to, since we are reaching out to the population and also to the doctors who might not be so expert in the field, where should they really look at this thing? In the box? Is there like an indication of that?
Yeah, it is on the box is a so-called quality seal printed. And if you have this quality seal on the box, this means this stocking has been tested every year by an independent textile institute, according to compression profile, according to durability. Durability should be minimum 6 months with full compression. And all these is certified by this quality seal on the box of certain stockings.
And in this sense, as I was saying before, I was asking you what we do wrong and what you suggest us. If I can suggest, just make it as big as possible. So it's clearly evident that there is this mark that maybe some other products don't have. And does this apply also for the adjustable compression wrap? Because another issue we are pointing out is the post-market analysis. Take, for example, the devices. There is, for example, one kind of glue that has been validated after at least 5 years of randomized comparative trials. And then there are others who actually did not receive this validation, but then the consumer thinks it's like all the same, it's always glue. Same, for example, for adjustable compression wraps. Is this kind of validation process applied also to adjustable compression wraps like Circade or what?
Yeah, not now, but they are planning this for the future. This means for Circade, for example, it is not compulsory, it's only voluntary. But in the future, it should be also compulsory.
Then my suggestion would be put a nice leaflet with a lot of the references of the scientific data you have.
We will do so. We will do so.
And the great expert on these aspects is for sure Sriram, who has an expertise that goes 370, not even 60 degrees around. So, Ram, would you like to jump on that?
Yeah, my issue with compression has been twofold. One is the ease of availability without prescription. There has been some issue. You can buy compression stockings of some sort, flight socks. You can buy them in an airport. You can buy them online. You can buy them on Amazon, whatever.
You're right.
And I have issues with that. And the issues are twofold. Firstly, the loophole has been created by us in the medical fraternity. We don't prescribe. We suggest. You don't need a prescription. The damage that compression can cause, I mean, it's very useful, but the damage that compression can cause is not insignificant. You put it in a diabetic without having measured pressures, you could create serious damage. We have definite evidence that in the venous return scenario, not in the lymphovenous edema scenario, that venous return is probably superior with the calf wrap than with the compression stocking. I'm proud of that because we did the paper, so we know that. We do not know how do we standardize thigh compression. We don't even know what the correct criteria for thigh compression is. Circade's thigh compression wrap is probably our standard now for post sort of above knee endothermal ablation. It definitely seems to reduce bruising and pain, and we are recording data on that. But my point is, there are scenarios like this where we in the medical fraternity have left loopholes. And we haven't been encouraged by the industry to plug those loopholes because it allows all sorts of stuff to get on the market shelf. So perhaps that interaction between us is important from our point of view to ensure that we have the right prescriptions and the right patient gets the right kind of compression. And from industry's point of view to say that, you know, compression does need to be regulated to some degree. For example, in nutritional medicine, you have supplements galore that are available off the shelf. There is not that much published evidence, but there is a very good reason for there not being published evidence. There is an industry desire not to have it prescribed. They want it over the counter. It is easier to sell. And so they would rather not go through that $250,000 FDA registration or whatever the current price is and run through an RCT and things like that. It's just easier to put it out in the market. So I think there's a fault on both our sides, and this kind of interaction is essential. If, especially with data both from Jean-François Zoul on paradoxical compression and its role, and our own work on venous return being better with the calf compression than with the stocking, there might be, as Sergio suggested, a very real case for standardization and certification of calf wraps, Circades and the like, and Sigvaris makes a set. Barfine makes a thigh compression stocking, just a thigh wrap, which is like a stocking. So these things do need to be standardized because my thigh and Sergio's thigh are a bit different.
And indeed, we made a publication on that, pointing out how the leg shape requires proper material, because if you don't have certified material, basically you don't create the graduated pressure you want to create. And this is so fascinating to me because it's really a science. You were mentioning indeed the advantages potentially of an increased ejection fraction if you have, for example, more pressure on the calf. But at the same time, it's not just about that, because all the other parameters that are involved with the compression might need a graduated compression. So for sure, I totally agree on the need of standardization of the science behind that, while the prescription, paradoxically, I would say, is far away from being standardized, because it's like a drug. We cannot give just the same dose and the same pill to every kind of human being. And compression is exactly like that, particularly when we consider that's the help we have, in my opinion, against the Darwinian evolution of being biped, so being overwhelmed by the force of gravity, for which even if I don't have disease, but I stand up all day here in the hospital, for example, we demonstrated the potential benefit of proper compression, also in terms of cost for the society, because we are still talking about 1–2% of the social cost. But a lot of these costs is spent for not properly validated products. And you were mentioning a thing that is very interesting, the one of the arterial patients, because we are so stuck with the concept of the ABI. But at the same time, we demonstrated here in the University of Ferrara that if you have a low ABI, but you have the proper prescription at the near infrared microscopy, you actually have a benefit that is higher than when you have a higher ABI.
Exactly. Graduation from 12 to 18 millimeters of mercury is actually beneficial in arterial inflow, which is surprising. And then you go beyond 23 millimeters of mercury, and then you start creating trouble. So there is a fairly narrow window, which is why it should be a prescription.
And it really depends on the single case for what we saw, because it's not that much about the pressure level per se. It's about the material. It's about how you protect the different parts that are sensitive to the issue. And the amazing thing is that there are products, for example, MEDI has a product dedicated to the arterial patients that has been designed by very bright people, I guess. But we don't speak with those people. We speak just with the commercial parts that are trying to sell the products. Exactly. While we should speak with engineers or like the bright minds. Now, Uwe is an MBA, and of course he's very expert in that part, and it would be nice also to have next time in the next True Care, the engineer who thought about that parts, because that's where the collaboration comes for the benefit of the patients, I would say. Uwe, you have a comment on this? Or?
Yeah, first of all, I would say we as a manufacturer, we prefer prescribed products, as it's always better than to buy it at a drugstore or at an airport. That's the more the doctor is prescribing, the better for us. Secondly, I think we have to think about, as you mentioned already, the dosage of compression and the indication of a patient. As we thought all that PAD is a contraindication, absolute contraindication. It's not the truth. If you have a mild PAD, compression can be helpful. The same is with diabetes. So we have absolute contraindications and relatively contraindications. And we developed a stocking for mild PAD patients, which helps the patients. And of course, you have to make an APPI measurements before, but then you can prescribe this stocking also for mild PAD patients. And therefore, for me, the dosage, but also the indications and contraindications should be clearly recommended by a doctor.
I really like the statement that Ugo Parsh once said, a contraindication sometimes a good indication is, like if it was Jedi Master was saying. So we are wrapping up these 15 minutes because we have virtually to go back to the meeting room. So Willie, do you have any final comment on these aspects?
Yeah, so I think that certainly enjoyed the coffee break. I think the message I have gotten is really education, not only the education to the practitioners or the providers, but also the patient themselves. But I think more importantly, the messaging is very important. In messaging, we have to use languages that are understandable by these each individual entities. You know, you can't really use doctor's language and talk to patients. So from that standpoint, I think that you know, having a global overview, speak in his or her own terms is a good way of moving the field forward.
Ram, any wrap up?
Yeah, exactly. I'm going to pick up both on what Willie and you said. You used a lovely term. You used the word dosage. Dosage of a stocking, and I quite like that, because if I said that you needed propranolol, I don't just say you need to take 2 propranolols. I need to say you need 5 milligrams or 10 milligrams twice a day. You know, it's prescribed. There is a limit. There's a standard. And thank you for using that word dosage, because you're right. Stocking requires to be dosed. The degree of compression needs to be dosed, and perhaps that's the kind of language Willie is referring to. Because if I had to write just stockings, that's one thing. But if I had to make it down or put it down on a prescription pad as a dosage, then I'm going to have to think, and I'm going to have to know what the correct dose should be. So yes, that is a good term to use. And perhaps in our meetings now, we should start looking in terms of not just class X, Y, or Z, which there are variations between various parts of the world for what class 1 and class 2 and class 3 mean, but we should start looking at a prescribed compression dosage. And that's a wonderful term. And if there's one thing I take away from this coffee break, it's that you should have a prescribed dose of a stocking, but coffee does not need a prescription. You can have as much as you like.
This is great what you said.
well, unfortunately, it's not like the same for wine, I wish. But
no, it doesn't. Life tells you what wine's dosage should be. Either the police or you're on the floor. You will know when you've overdosed.
It is. Let's stay away from wine, from these like true care educational moments, even if we should be educated also on wine, of course. But Uwe, your final message on this?
My final message is that we all need more education in compression, and the dosage is the right thing. And we need good initiative like Win-Win Foundation, True Care, but also ICC. The more education, the better it is for the right usage of compression worldwide. Thank you very much for this great coffee break.
And indeed, if I were to say, indeed, we talk about dosages, but also about types. Like when we choose to put an intramuscular endovenous or oral, it's basically the same. If you think about bandages versus stockings versus adjustable compression wraps, that I think really have a role, particularly in the self-management need of this post-pandemic time. I think it's fundamental to stay away from misinformation in something that can be so helpful to our everyday venous hypertension control, which is, for example, also the compliance, the idea that stockings are unpleasant and impossible to be used. In reality, it has been demonstrated that up to 70% of times it's our fault as prescribers. We didn't prescribe it well. If I prescribe a too strict jacket, for sure it will be really uncomfortable. And it was also published that education of the prescribers goes with the proper application of compression that goes with proper management of the disease.
And so self-management is important for the patient. If a patient can use self-management like in a circuit product where he can put it on with Velcro wraps, this is also increasing the compliance and concordance of a patient. And this is good for therapy success.
And since the venous lymphatic disease is the most democratic one, because unfortunately
it's really
getting all around the world in high prevalence, I truly hope that the message of having true care for this kind of management is well taken, and that we will take a nice coffee and maybe also wine at the next coffee break in Dubai in February. Thank you so much, all, and we wish you all
Thank you very much.
Ciao.
Thank you.
Thank you.
Ciao.
Ciao, ciao. Thank you. Thank you. Bye-bye.